Hello and welcome to Behave, the podcast with your host, me, Dr. Tamsin Astor, Chief Habit Scientist, international speaker, and author. And I'm super excited today to have Tiffany here as my guest. Welcome.
Hello. I'm great. It's great to be here. I'm excited too.
Yay. So tell us a little bit about who you are.
Well, my name is Tiffany, as you said, and I am a rapid transformational therapist, a clinical hypnotherapist, and an NLP practitioner. And I practice in Chesterland, Ohio, in the US, a little small town here. And I transform people's lives. That is primarily what I do. And I'm not doing it on my own. I work with people, I teach them, and I kind of teach them skills for how to impact the subconscious mind, because we're all trying to change on a conscious level. So we're reading books, we're going to seminars, we're doing all these things, and it's great. And these were the things I was doing to change, but the change was slow. And I didn't like that. And I thought I had a lot of issues. I had a really rough upbringing. And I was spent 15 years in a fundamentalist religious cult. And I had a lot to work through. And the change was coming really slow. And I was really voraciously listening to YouTube videos, doing all that. All that stuff is so fantastic. It does really change us. But I wanted to find out, how can I change really fast? How can I change rapidly? So I went to a weekend seminar, and it was all about the subconscious mind and how it's basically driving our life. When we're driving a car, we're thinking about everything else because we know how to drive. Once something's well learned, it's not an issue for us. We don't have to think about it all the time. Problem is, when negative thought patterns and mindsets and behaviors are well learned, they're just running in the background of our life, and we're trying on a conscious level to change those because we recognize that we're sabotaging or that we're creating problems for ourselves. And then this is where I was stuck. And I went to this seminar. I thought, okay, how do I impact the subconscious mind? How do I do that? And I went up to the workshop leaders afterwards, and I said, this is fantastic. Now I know where the problem is. What do I do about it? And they said, read books, attend seminars.
And you were like, no.
And I'm like, yeah, but I'm doing that and I'm not changing. Right, exactly. So I'm like, I'm changing. But it's slow. I'm thinking, I'm going to be 90 by the time I'm happy. Okay, by the time I feel like I have confidence and a self-worth, and I'm, having a positive attitude, I'm happy. So I set out to find out, how can the subconscious mind be impacted? For a long time, I really missed the whole realm of hypnosis. Well,
it's interesting hearing you talk, because I've heard that the subconscious controls about 95% of what we do, right? These patterns that are going. And so one of my coaches used to say to me, the subconscious always has veto power. Right? If you are not willing to get in there and do the digging and do the reprogramming, whether it's through affirmations or tapping or NLP, and maybe we'll dig into NLP because I bet you there are some listeners who don't know what that is. But if there isn't some way that we dig in there and figure it out, that's always going to take precedence over whatever we're doing on that conscious level.
And this explains exactly why women will continue to consistently date abusive men. Okay. And I've known plenty of these women, and they will set out and say, I absolutely will never do this again. I've dated 4 men. They've all hit me, and I'm not going to do that again. And they find themselves, looking out there in the dating pool, and they pick a man and they go, okay, he's not going to hit me. And of course, the man assures her that he's not going to be like the last 4 boyfriends who, beat her and slapped her around. And what ends up happening? Inevitably, and I've known dozens and dozens of these women, they end up abused again repeatedly. And they seldom break out of that pattern. Why? When on a conscious level, that's the last thing they want.
Right.
And if you probably heard people say, oh, women, they like that. They want, and that would get me so angry. No one wakes up in the morning and goes, I think I want to be miserable and have the shit beat out of me. Nobody does that.
So okay, I've got 2 questions now for you. When somebody comes from you, what is the kind of transformation that they are coming to you that they're desiring, but they're not able to maybe articulate. So, if somebody's listening, they can go, oh, like that's where I'm at, right? Because transformation is quite broad, like it could be in sort of lots of different areas of your life. So what for you is the kind of transformation that you're looking for and that you love to support people through?
Well, most of the people that come to me, they have an issue. Okay. So they come in, they say, I have anxiety in
Okay.
social settings, or I'm very depressed and I think it has to do with my relationship. So they don't really know what kind of transformation they want a lot of the times. And that's what I help them work out in the initial part of my session. My sessions are long, they're 3 hours long. So that first hour is, what kind of transformation do we want to create for you? And I don't tell them what it is. I
Right.
help them to create it, because a lot of
Right.
times people are so long in anxiety, so long in depression, that they don't even have a visual of what life is going to look like. And for some people who've been raised with a lot of childhood trauma, they've never had a life that's been free of anxiety or depression. And
Yeah.
so they don't know. So let's paint a picture of that for them. Because basically, the subconscious mind responds to suggestion. Now, how do we know this? Because when babies are born into this world, okay, they're just neutral. They're happy. I mean, as long as your diaper is changed, you're not in pain, you're well fed, mom comes in the room, you smile, you're happy. Babies never are insecure. They don't worry that
Right.
all the other babies are what the other babies are thinking. They don't
Right.
look down when dad's changing their diaper and go, oh my God, my fat rolls.
Right. Right.
I mean, they don't ever do this, right? So, those things are programmed in
Yeah.
by
Yeah.
family, by peers, by the school system, by religion, by culture,
Yeah.
by society,
Yeah.
by the media. And so, and all of that comes into our brain via suggestion. It's what we're told.
So
And
what
that
you're doing is
part.
helping to, right. And so what you're helping to do is redefine that, right? And create new pathways. So you've mentioned NLP. Will you describe for our listeners what NLP looks like, what it means, and what the process is of using that with people to help them in this process of transformation?
Well, there's various processes involved, but it's basically using the language of the subconscious mind of the brain to impact the brain. Our conscious mind is impacted a lot differently, and so it's learning what that language is and being able to use that. And because ultimately, like with what I do, I want to first take a look at where this programming came from. Now, that's pretty much a lot like people go into regular standard psychotherapy for.
Right.
So they're like, okay, I want to find out why I have this issue. But instead of just finding out why you have that issue, that's helpful. And it helps to bring self-compassion to that individual. Okay, I'm not just a complete loser. There's a reason I think this way,
Right.
and so we bring that to the client, but also you can reframe that for the subconscious mind. Okay, because your subconscious mind is reacting to things that were said, things that were done. And now going forward, it's still reacting as if those things from the past are completely relevant for today.
Right.
But we can neutralize and reframe that for the subconscious mind so it's no longer reacting to past events. And that's the beauty of what I do.
Yeah.
The package that I do, that 3-hour session, is called Rapid Transformational Therapy, which was devised by Marissa Peer there in London.
Awesome.
So yeah, and so I was trained in London with Marissa, and it's a wonderful, very comprehensive technique. So after reframing those past events and neutralizing, now it's almost like we've cleared the soil to plant a new garden. You wouldn't go and plant a garden and leave all the weeds in and expect anything to grow. So we're getting those weeds out of the subconscious mind. And now we're going to sprinkle in new suggestions. So just as the mind responded to suggestions as a child, now the mind can respond to the new suggestions that I'm putting in there through hypnosis.
I love it.
Yeah.
Wow. So this is really juicy, like kind of like heavy stuff. I'm sure people are coming with big things to shift. So did you go through personal experiences that got you to a place of going, like, I need the skills, I need to heal myself, and now I want to like put this out in the world for other people? What was your journey into this, Tiffany?
Well, I spent 15 years in a independent fundamental Baptist cult, and most people in the United States don't consider fundamental Baptist churches to be cults, but they are. And it's very oppressive, particularly towards women and children. There's a lot of abuse that goes on. For children, there's a lot of physical abuse, and for sometimes for women, but mainly the abuse is very psychological. The theology is very demeaning, especially towards women. You know, all the sin came into the world because of women. And you're basically a very evil person. And God, is always displeased with you. But thank goodness, he decided to save you, And yeah, so it's very psychologically oppressive. And so as I'm trying, the longer I spent in there, the more depressed, the more anxious I got. Because there are, and I know you know this, but there are certain things that happy people think. Happy, well-adjusted people think a certain way. Unhappy, anxious people think a certain way.
Yeah.
And as I began to study and research and try to find out how am I going to get out of this anxiety and depression, because therapy wasn't an option within this group. It was, you read the Bible, it has all the answers. The more I read, the more depressed I got. And, everything was filtered through the lens of what I was being taught. So interestingly, I just kept getting worse, more depressed. I'm watching my kids suffer, and I'm looking around me and going, all the women are depressed, and I could see a plethora of health-related illnesses. And I've always been a reader and a researcher. So the more I researched, the more I thought, okay, here's what, according to the research, you're supposed to think. And it was polar opposite of what I was being taught. So I began to leave that group. It was very difficult. You lose everything. You lose all your friends.
Right.
I definitely
excommunication, right?
Yeah, it really was. I'm not entirely. There are a few people that still talk to me, so it's not as cut and dry as the Amish.
Right.
But I ended up divorced, and that had a lot to do with that scenario as well. So I was kind of thrust out in the world with zero self-worth.
Right.
And the first relationship I got into after being divorced was abusive.
Because you were in that, because you had that subconscious programming, right? Of like, I'm supposed to be demeaned, I'm supposed to be controlled, I'm quote unquote inferior to men, and all of that stuff that had been programmed into you, right? For 15 years.
And that's exactly what I attracted. I just, it's funny because my lawyer said at our first meeting, she goes, "You're just a sweet girl. And I feel very strongly that you're in for it. You are very naive."
Wow.
You are pretty naive about life, because I lived a very sequestered life.
Right.
I wasn't in like a, Amish community or anything. It was very sequestered. I pretty much had very little contact with anybody outside of the religious community. And so I went out into the world, and I fell prey to a narcissist very rapidly. Someone who actually, I found out, had actually been diagnosed with psychopathic personality disorder. And I did not know that, because I got love bombed, just like cults.
Right.
Love bomb you.
Draw you in.
I got love bombed. You're so wonderful. You're everything I'm looking for. And I just absorbed it like a sponge.
Yeah.
And the whole subsequent abuse and the breakup and disillusion of that relationship left me at the lowest place I'd ever been in my life. And that is when I was invited to the spiritual retreat where I learned about the subconscious mind. And that was if there's anything that was a turning point in my life,
right.
Learning about the subconscious mind was it, because now I thought, because I entered into that meeting that day, it was a Friday night, I walked in the door, and I felt like I am the most worthless loser out there. And this man had just beat me down with how worthless I was and what a loser, and every little insecurity that I already had. He
Right.
had monopolized. And so
Yeah.
it was just, I was in a really low place. And then to learn that
That
there
you
was
had this power.
yeah. And it's one of the things I teach my clients. You're
Right.
not broken
Yeah.
and you
Yeah.
don't need to be fixed. And they're coming in
Yes.
like, they're
Ah,
like, what do you mean
yes.
I want to be fixed? I have this
Right.
horrible anxiety and I want you to
Right.
fix me.
Yeah. Yeah.
And
Yeah. Yeah.
it's not that you're
Right.
not broken. You don't need to be fixed. What
Yes.
needs to be fixed
Yeah.
is not you. It's
Right.
thoughts.
Right. No, that's true.
That.
I had a guy tell me that I was broken, and I was so it was really traumatic for me, because I really, had to step back and say, I'm doing the work. I've told you where I'm stuck. That does not mean that I'm broken, because I'm working through this. Yeah. So for you, this was this moment which really enabled you to recognize that, I mean, it's almost like radical responsibility, right? Like freedom of like, I can change this, right? I can create lasting change if I can get in there, right? That's what it sounds like was your sort of epiphany moment, right?
Yeah, I call them now Tiffany epiphanies, just so you know, because I have them quite often, and they're usually very profound thoughts. Sometimes I've had them more than once, and it'll be the same one.
Yeah.
5 years ago, it didn't quite sink in,
Yeah. Yeah. Wow. So you had this extraordinary experience. You freed yourself from it. You recognized after falling into another pattern of, being in that and in being in that abusive relationship that if you learned these skills, you could take it on. So that's what led you on the path to becoming a transformational therapist, was your own personal story, it sounds like, right?
Well, first I actually went into physical therapy. And then when I got divorced, I went to college to do that. But I kept reading and I kept learning and still thinking, how can I impact the subconscious mind? So I came across the work of Joe Dispenza, and I'm sure you're familiar with his work. His fabulous books, Evolve Your Brain and so forth. Now, the frustration for me, and I'm not downing Joe Dispenza at all, he's a wonderful person, author. The frustration for me was when I got to the end of the book, and here's how you transform your brain. And I thought, now when I divorced and left and entered college, I have 5 children at home. I've had 7 children total. Okay.
Wow.
So how is a woman with this many children trying to go to school full time going to spend an hour and a half meditating, visualizing, doing all this? And I felt like someone just popped the bubble.
Yeah.
And just diffused my hope that's building throughout this book about I'm going to create this wonderful change. And I thought, there's got to be another way. I cannot do this. If I could squeeze out 10 minutes, 15 minutes of meditation, maybe at that point in my life, but I was only sleeping, sometimes 4 hours as it was. I'm not going to spend an hour and a half of that meditating.
Right. Wow. Yeah, no, and that is, I think there's often, and I say that to people with habit change, right? Like people often get this idea that it's only going to work if, I'm doing my 90 minutes of yoga, I'm doing my hour of meditation, I'm doing my whatever it is, and what I say to people is reduce it to the ridiculous. What is something that you can stick with and make it a habit? And then once it becomes a habit that you're committed to, it'll probably expand a little bit, but like, don't set your expectations of I've got to get up at 4 a.m. and meditate for 90 minutes and do yoga for 90 minutes. And, we are, a lot of these practices were designed for people who aren't in what they say in the yogic and Buddhist traditions. They're not householders. They're the people who are living in the monastery, and it's like, well, that's fine. You can go do that. But us householders who are out there in the world raising children and going out to work and doing the dishes and the laundry and all of the life stuff, like we don't have that 3 hours every day. So how can we make this work for ourselves? Yeah.
And that was the big question in my head, because I could see that I was still on this destructive path.
Yeah.
And I knew it, but it's like, how do I get, so I'm saying affirmations, in the mirror in the morning or whatever, and I'm still making stupid decisions, and I'm just like, and I'm still mostly, I think the driving force behind change is human misery. I mean, if you're happy, thinking wrongly, you would probably stay that way. But
right. There's no pain to motivate the change. Yeah. No, that's so true. You say that, because I've had that with clients, like clients who come to me with a kind of, I sort of think I should get my habits together and I should, maybe get this habit, like maybe I should start exercising or whatever. I'm like, no, no, like you need to be uncomfortable enough to put the time, the money, and the effort into doing the work to change your experience. Because if you're coming to me with a kind of, I'm like at a 5 out of 10 desire to change my life, I'm like, yeah, you're not ready, baby.
Yeah, and what'll happen is life will turn up the decibel level on that,
Yeah,
and the pain becomes so uncomfortable that we're like, I got to do something, I got to change. And what
yeah,
do people do
yeah.
when they are confronted with that pain? Unfortunately, what most people do is not change. They go, how can I get rid of the pain? So it's just
Right. Suppress the symptom or numb it out. And it's so interesting you say that, because that's how I got into Ayurveda, is that I was struggling with insomnia and food allergies and weight loss and weight gain. And the doctors couldn't figure out a common like cause anything. So they just their approach was to give me drugs for symptom suppression. And I was like there must be something underlying, but I'm not going to just randomly take, antihistamine, sleeping pills, painkillers, whatever, because you don't know what's going on, right? And I think that's such a sort of feature of our culture. It's that quick fix, like I broke a thumb and I went to the ER and she's like, you need oxycodone or whatever, one of those really hard, ones that everybody gets addicted to, right? And I said, you know what, like it's my right thumb, I'd rather just take really high dose ibuprofen so that I don't use it, because if I have no pain, I'll probably end up like opening the car door, trying to use it, trying to pull up my pants and make it worse and not let it heal. You don't understand. You're going to be in a lot of pain. You need these drugs. And I was like, no, really, I'd really like not to, like I feel like it's important that I feel a little bit of pain to remind me not to push myself, that you're going to be in a lot of pain. And I was like, stop trying to suppress the symptoms. I'm telling you, like, not that I'm a masochist, but like, I want to feel a bit of the pain. I mean, I say this, I want to feel a bit of the pain, right? Like, and like,
yeah.
so that I'm careful with myself. But yeah, no, it's so interesting, that whole approach to, when symptoms come up, do we numb? Do we get on Netflix? Do we overeat? Do we, shop, rather than go, what's the root cause?
Well, and repressed pain, trying to repress pain is the main driving factor behind most people's addictions. And it's really sad, because think about it. I mean, if you broke your leg and it's clearly broke and you go to the ER and they say, here's oxycodone, but we're not going to put your leg in a cast,
Right.
you just think, oh my God, what's wrong with you?
Right.
But that's what we do psychologically.
Yeah.
Even in the psychological community, people go, and in the United States at least,
Yeah.
okay, here's your antidepressant.
Yeah.
Antidepressants never have a usefulness, but let's also find out why I'm depressed.
Right.
Because the brain doesn't send pain messages for no reason.
Yeah.
So when you break your leg, that pain is to tell you not to walk on that leg.
Right.
When you have an emotional pain, that pain is to tell you, something's wrong. Okay. Something in my life needs to change. Okay. Something from my past needs to heal. Or you have a limiting, destructive, and toxic belief. So it's usually going to be one of those three things,
right,
that your brain is telling you. And what do? We suppress.
Right.
We suppress, and it doesn't get healed. So it's going to resurface.
Yeah.
And even with, a lot of times one thing I learned really quickly in physical therapy, which is how I found hypnosis, because I'm having these patients come in and they're in chronic pain, low back pain, neck pain. And I said, when did your pain start? When my wife died. When my husband had a brain injury, my pain started. Or when I got married.
Right. So right. So what you're alluding to there is like that book I love, The Body Speaks the Mind, right? Because I think so often people are like, I've got chronic backache because I, was in a car crash, which is like, yeah, there, and of course that happens too. But I think so often we negate or minimize the power of the mind to create physical pain, right?
And it will, if you will not listen
Yeah.
to the messages the mind gives you, it's going to yell louder.
Yeah.
And if you won't listen to the emotional message, then you're going to suppress that, because perhaps you learned as a child that grieving made you a pussy, you know.
Yeah. Right.
You
Right.
learned that
Right.
that anger was sinful or inappropriate emotion. So
Right.
if you're not able to express that, it will come out in physical pain. And
Yeah.
people think, well, that's nice that that's your opinion, but there's a lot of hard clinical data supporting that.
Absolutely. Yeah.
Or Mate's When the Body Says No is a great book. And I have found working with people with physical pain issues or illnesses, that is a common theme, that there's an area in their life where they're not saying no.
Yeah.
They're not able to say, this is who I am and I'm going to be myself. And you're not going to step on me.
Yeah.
There's an area where they want to say no and they just can't because they feel like they can't be themselves because they have
Yeah.
a belief that I have to please everyone, or the way I am is not okay.
Mm.
Maybe I'm a homosexual and the culture in my family says that's not okay, but that's who I am.
Yeah.
So they repress who they are, and then they might end up with some physical or emotional pain instead of living out to be their true and authentic self, you know.
Wow. So, if somebody is, feeling that, like they're starting to get those physical symptoms, what would be your first suggestion?
Well, you do need to have everything checked out by a doctor. I mean, you have to do that because you don't know.
Right.
But when the doctor's given you a clean bill of health, I
Now
I
it's
don't
time
know.
to dig.
Or,
Yeah.
or you've had a physical injury, and the 12 weeks is your average time for tissue healing. So it's you bent over, you pull the muscle in your back. It's now 4 months later, and you're still in pain. The tissues have healed.
Mm-hmm.
So it could be a muscular skeletal issue and you need to be adjusted. But if you're having chronic pain like that, it's always good to really look at psychosocial causes. And
Right.
the literature is replete with
On
evidence.
that. Yeah.
I
Yeah.
mean,
Yeah.
it's
Yeah.
not something that we're theorizing about at this point.
Right.
So,
Right. Okay, so I love this, Tiffany. This is great. So I'm going to ask the 3 questions that I ask all of my guests.
oh, wait a minute.
And
Okay.
the first one is, what behavior do you still struggle with, even though you've done a lot of work around it, but it's still something that like pops up or flares up when you're under stress or feeling overwhelmed, or fill in the blank?
I think it's what you just said about being overwhelmed. So
Mm,
I struggle with allowing I've got to get this done. I've got to get this done. I've got to get this done. And not realizing that I'll get done what I'm supposed to get done. That's where kind of a spiritual perspective comes in for me, that I'm guided and directed throughout life. That's my personal belief now. So I'll get done what I'm supposed to get done. And what I do is I tend to start neglecting self-care. The
mm,
minute I start neglecting self-care, everything falls apart. I'm not
right.
sleeping as well.
Yeah.
You think about it. When self-care is your first priority,
Hmm.
it's how you start your day. It's how you end your day.
Yeah.
You're going to get done what you're supposed to get done. And you're actually going to have a lot more clarity of thought in the
Yeah.
end than if you're not sleeping and working yourself,
Yeah.
to death. And that's what
Yeah.
but I still do it. I still
Mhm.
fall into that trap of where I'm like, wait a second, I'm not sleeping. I'm spending too much time at the office.
Ding,
Yeah.
ding, ding. Time to make a change. Yeah. I love it. Okay, so the second question I love to ask everybody is, what is your favorite quotation and why?
Okay, so weirdly, my favorite quotation, it changes all the time, but right now it's Lady Gaga. How
Mhm.
intellectual is this, right?
I love it.
Sometimes you need to just stop crying and go kick some ass.
Yes.
Okay, I love that. I'm actually going to have that made into a sign.
Hmm.
I don't know if I'll have someone make it up or if I'll just print it. And I'm going to hang it in my office because I want my clients to see it, and I need to see it.
Yeah.
I need to see that as well.
I love
So
it. Yay. That's really fun. All right. And then my third and final question is, if you had a theme song that played when you entered a room and everybody would be like, oh, Tiffany's here, what would it be?
that's a hard one because there's so many songs I like, but I think right now it would be I Am Enough. And I think the songwriter on that one is Daphne Willis.
Mm-hmm.
And it's a song that hardly anybody knows about.
Well, we'll put a link to it in the show notes so that people can.
Yeah. And I think it's a fantastic song. And there's been those songs throughout the years that you latch on. But I actually, one of the things I teach my clients in my online program is to choose a theme song, a power song, and to play that song every day when they get up in the morning, and set their mindset for the day along a positive vein. And I'll tell you, it makes all the difference, because there were times as a single mom when I was in college, and I'm thinking, I got 3 hours of sleep, I got an exam, and I have to go to this nursing home, it's in clinicals, and I have to meet these crabby people who aren't happy. Yeah, and I would think, I just don't know how I'm going to face the day. And I would put on a song, and I think, okay, I'm a badass, I can do it. Yeah, and so it depends on what kind of mood you need to summon. What kind of song you should pick. So I think you should have a list. And in my online program, I give women a list of empowering songs.
I love it.
They can pick what they like if they can't think of anything off
themselves. Great. Awesome. Oh, I love this, Tiffany. Thank you so much. So tell me, where do you hang out most online? Where can people find you and connect with you?
Yeah, mostly on Facebook, just Tiffani Cappello. I use my personal Facebook page a lot. And I also have a lovely, lovely group of women called Transform Women on Facebook. Fantastic. So that's where I, provide help and support. And, you can even ask for advice on there if you're struggling with something.
Wonderful.
And other women will chime in. And we're an encouraging bunch. Of lovely ladies. There's no criticism and snippiness going on in there. Fantastic. And if you are coming out of a religious cult or want to learn more about whether your religious beliefs might be toxic, I have a fantastic group called Former Fundamentalists. We're a little exclusive. You're not allowed to be a fundamentalist to be in there, obviously. I don't think very many of your listeners would fall into that category, but it's a place of support and love at a very difficult time for people coming out or wanting to come out of those groups.
Awesome.
Yeah, and I have a website, tiffanicappello.com.
Great.
It's easy to find me there, or transformedwomenacademy.com as well.
Brilliant. We'll put those links in the show note. And thank you so much for coming and sharing part of your personal journey too, and giving lots of useful tips to think about how to, move into a place of transformation. And I love this idea that we can do it rapidly and we don't have to stick in it for years and years and years. So thank you so much for joining me today, Tiffany.
Thank you. It's my pleasure.